Hello everyone, my name is Emily Martin and I want to talk to you today about safe injection sites in Seattle. This topic is very important to me because it stems from the topic of addiction and counseling, which is where I hope to build my career around. I decided to write a letter to King County Executive Dow Constantine to discuss the future of safe injection sites. Dow Constantine proposed safe injection sites with previous Mayor Ed Murray a year ago, but with Trump's DEA and community concerns of the safe injection sites, they've been halted in their progression. The letter I wrote was less about convincing him about the pros of safe injection sites, but more about their future and making sure it stays implemented long enough to notice long-term effects, and about its structure and location. Currently, King County is working on adding a fixed mobile van as a safe injection site for people in the community to use drugs safely. Volunteers and recovery resources are also available for individuals. At this point in time, they are testing the idea with one van and are trying to decide where to put it so people have equal access to it. I have become passionate about this topic, not only through my counseling education, but also my desire to help those in my community. There's been a large debate around our community in Seattle and across the United States about whether these safe injection sites are a good idea. Many in Seattle do not want a brick-and-mortar location for the injection sites, so the county chose to use a fixed van, which will stay in the same place for people to use. Although I feel like this is helpful, I think a mobile clinic van won't be able to support the number of people in need and to be able to provide the number of resources required. Although the mobile van is a cheaper alternative to a brick-and-mortar location, there is an air of this is temporary or uncertainty. I hope that safe injection sites can be implemented long-term in a brick-and-mortar location to ensure even further a safe place for those wanting to be safe while using and for those seeking recovery options and resources. As many of us know, the United States is experiencing the opioid crisis, which has turned into an epidemic in Seattle. King County Public Health Department reports in 2017 there were 379 drug and alcohol-related deaths, and 69% of those deaths were due to opioids, including fentanyl, which is a synthetic opioid used in treating severe pain. For scale, it is 50 to 100 times stronger than morphine. Fentanyl-related overdose deaths are rising in King County and is one of the main drivers for nationwide increase of opioid-related deaths. In addition, 17% of the people who overdosed in 2017 were homeless, and this number is expected to rise in 2018 according to King County Public Health. King County Public Health also states that the homeless, those living in poverty, and marginalized groups are more likely to experience a lack in needed resources like clean needles, medical attention, medication to help if people want to recover, and mental health support. I feel that safe injection sites are important to provide within the epidemic in Seattle because of the stages of change model for addiction. Addiction is a disease and it can be difficult to recover from. Having safe injection sites with access to resources will help reduce the number of deaths from overdose and will help connect individuals to potential of recovery. In addition, addicts have thoughts about getting clean in the darkest moments of their addiction, which a lot of times is when they are in the process of using. If professionals can jump in during this moment, then recovery can become a reality for many struggling in our community. Maybe some of you are wondering how this is connected to social justice. Laura Burney Neeson of Portland State University wrote an article about strengthening a social justice lens for addiction practices. Many people view addiction as an individual and/or a family issue rather than a public health and community safety problem. In addition, the criminalization and possession and consumption of drugs is a social justice issue that ought to be addressed in the implementation of safe injection sites. Criminalizing drug use and possession ultimately does more harm than good. Substance use disorder is recognized in the Diagnostic and Statistical Manual of Mental Disorders, which is a tool for clinicians to help identify symptoms to different mental health disorders. So if we are willing to put people in prison for what is now recognized as a mental illness and health issue, what mental health disorder are we going to criminalize next? This is where I see a lack of social justice and advocacy for those struggling with addiction and not being met with resources, but rather criminal charges. As I am advocating for safe injection sites and decriminalization, people with substance abuse disorder, it is important to discuss what is being called the Portugal model. In 2001, Portugal decriminalized drug use and drug possession in hopes to reduce the influx of people entering jail or prison, who would ultimately reconvict upon their release. The Portugal model gave warnings, small fines, and told people to appear before a local commission, which included a doctor, a lawyer, and a social worker about treatment, harm reduction, and support services available to them. I wonder what the United States would look like if we had such a model in place. I think about Isaac Newton's laws of motion, specifically the third law, which is, for every action there is an equal and opposite reaction. Although Portugal has seen a lot of positive changes, including lower rates of HIV, hepatitis infections, overdose deaths, and drug-related crime and incarceration, there was a different change that occurred, specifically in the health and medical fields. Because people were not being criminalized, the health and medical fields had to take on more cases of long-term drug use complications like hepatitis C, cirrhosis of the liver, and cancer. This was a challenge for the field, especially with recessions and budget reductions for community health clinics. The clinic's infrastructure had a hard time keeping up with patient care, especially for those struggling with addiction, specifically continual admittance for overdose. In my ideal world, I would want to advocate for both safe injection sites and decriminalization of drug possession and consumption. As Martin Luther King has said, injustice anywhere is a threat to justice everywhere. Addiction, overdose, mental health, and drug trafficking are not issues that are only in King County. It is a global crisis, and a small step towards helping those facing addiction will have a larger impact on people and communities all over the world. I think the addition of safe injection sites is a good first step to see how it will affect our community, because our current system is unjust and is not helping people create long-term health choices. But I think one of the things we must keep in mind, outside of all the politics, is to be compassionate and to support those who cannot support themselves. Even small changes, like a safe injection site van, will make a big enough change for someone's life, especially lives in our community. I want to thank you for taking the time to listen to my presentation. On the next slide, I have some resources that I found for this project, and if you are interested in some of the things I talked about, go ahead and take a look. Thanks.